Teaming up with Democrats over the new health care bill, claiming people with pre-existing conditions could see their premiums rise.
People could be charged higher premiums who had pre-existing conditions.
We have a lot of pre-existing conditions. I have a lot of people that are elderly.
What this is really about is the people who rely on, depend on the guarantee that that coverage of pre-existing conditions.
But weren't premiums already rising under Obamacare? Joining us now for a fair and balanced debate, former Ohio Senate Democrat Minority Leader Capri Cafaro and editor of Red Alert Politics, Meyer. Ron, under Trump, these pre-existing conditions and premiums are on the rise. What did he do?
Yeah, it's all Trump's fault. That's what Jonathan Gruber said yesterday, right? I mean, here's the thing. Harvard said recently that millennials believe half of their Facebook feed is fake news. Frankly, in the last week, I think it could have been more than that because of this debate. The truth is that the GOP plan not only covers pre-existing conditions, but then on top of that, they established a $138 billion fund. And the truth is that really the individual market is just 7% of all Americans. And of that 7%, only 4%, so a smidgen of a smidgen, have pre-existing conditions in the individual market. And the Republican plan gave $138 billion to subsidize to those people. So the idea that they aren't covered is absolute fiction. The truth is that the media just didn't want to read the bill, didn't want to actually see what's in it. And frankly, if they did, they'd see that this actually does take care of pre-existing conditions. But what it doesn't do is make everyone else pay for them. And that's the problem with Obamacare. Everyone else's fees and costs and health care premiums are going up. And what the Democrats don't want to talk about, what the media doesn't want to talk about, is that this GOP plan actually lowers premiums and costs.
Capri, you don't want to talk about this. You heard Ron. You don't want to talk about this.
That's absolutely false. And I will tell you that I am the no-spin zone when it comes to this issue. I'm a licensed social worker that was trained in a level 1 trauma center. I spent my entire adult life in health policy and authored Medicaid reform in Ohio with a pretty, market-based approach, frankly, to lower costs. Here is the true issue. Yes, the Affordable Care Act or Obamacare is not a perfect plan. And in some states and in some instances, yes, premiums have increased. Unfortunately, under the HCA, the Republican plan, and I have to respectfully disagree with my colleague, number one, the subsidies for the supposed high-risk pools are not going to be sufficient to be able to meet the needs of those with pre-existing conditions. Number one, we have data that from previous states that have had the high-risk pools prior to the Affordable Care Act. It has proven to be ineffective to meet the needs of the very high costs associated
Ron, answer that question. What Capri's saying here on this pre-existing conditions.
The Investors Business Daily just had an article on this. The fund actually would be about $32,000 per year per person with pre-existing conditions. If that's not enough of a subsidy, I don't know what is. And the truth is, in some ways, that's more of a protection than what they had under Obamacare.
Let me say this. My very best friend has rheumatoid arthritis, and she has coverage through her employer. Had she not had coverage through her employer, she needs infusions every single month that cost $22,000 in order for her to continue to work and keep rheumatoid arthritis at bay. That's a month, not a year, per person. There are a lot of realities here. In addition to that, the elimination of the community rating that stabilizes those out-of-pocket costs for those with pre-existing conditions would go away. So that's an additional protection here that we are not talking about. The other thing that I really want to bring up that is being lost on this is the issue of pertaining to the waiver that the states are getting. It actually can impact employer-based health insurance. So the smidgen of a percentage actually may not necessarily be the only population impacted by this bill. And here's why. Employers could actually choose a new plan out of a state that has these waivers that are a slimmed-down plan. So if you have employer-based health insurance, you actually could end up with a plan that now, all of a sudden, after a few years, is dealing with lifetime limits, increasing out-of-pocket costs, and not protections for those that have
Ron, address that point there, this idea that an employer could then go out of state and get a plan that isn't in their own state.
Well, she had to use about 6 different hypotheticals, if this, and if this, then this, right? And that's just ridiculous. Here's the truth. It's just like where I started. We're talking about what the Democrats and the media wants to talk about, which is a smidgen of the health care market. When did Democrats forget about the average American worker who's seeing their health care premiums go up? And the reason why they've forgotten about them is because this plan is going to bring down their premiums. This plan is not perfect. In fact, Rand Paul is a great addition to put in buying groups that would bring in premiums down even further, especially for those with pre-existing conditions. I think that should be added in the Senate. But the truth is, why did we stop talking about bringing down costs for Americans? We have the most expensive health
Let me say
care.
this. I totally agree with
10
you.
seconds.
I totally agree with you. The way that we structure premium support actually does less than more. You're not going to get as much bang for your buck under the Republican plan. We need to focus on wellness, increasing access by improving health outcomes, which reduces cost,
All right.
and pay for performance.
Well, I'm glad we solved health care this morning. Capri, Ron.